Earlier this week, the Virgin Islands Police Department conducted a raid on the Walter Ian Hodge housing community. Virgin Islands spokesperson for the police department, Melody Rames, gives us details on this raid.
Police on St. Croix discovered marijuana plants, a firearm, and ammunition while responding to a call of shots fired. According to the initial report, a 911 call of shots fired in the Walter Ian Hodge Pavilion housing community was received at about 1:04 p.m. Monday, May 4th. Officers from B Command responded and made a check. However, there were no signs of activity in the immediate area. Officers expanded their search and discovered a makeshift shack in the bushy area east of Building 17. Inside the shack and on the roof, police found a total of 39 marijuana plants that were at least 2 feet tall and a number of other marijuana plant seedlings. Fertilizer and other growing aids were found in and around the shack. Police also recovered a 9mm firearm loaded with 13 live rounds of ammunition, which was hidden in a flower pot. Forensic unit technicians and Project Safe neighborhood officers also responded to the scene.
Thanks, Melody, and stay with us on News Channel 8. We have more news after the break. Welcome back. And yesterday, the Health Department conducted a press conference on the H1N1 influenza, otherwise known to most of us as the swine flu.
The purpose of this press briefing today is to provide updates on the probable cases of H1N1 influenza, also referred to as swine flu, in the U.S. and in the territory. We will also discuss actions taken by the Office of the Governor, the Department of Health, and other governmental and private agencies in addressing this matter. Currently, the Centers for Disease Control and Prevention, or CDC, is reporting 403 laboratory-confirmed human infections with novel H1N1 flu in the United States. Human infections with H1N1 flu virus have been confirmed in 38 states at this time. To date, we still do not have any confirmed cases in the U.S. Virgin Islands, and I'd like to reiterate that. To date, we still do not have any cases in the U.S. Virgin Islands. This virus is spreading from person to person, and children have been more likely to be identified as affected with this virus compared to older adults. Last week, the threat level was raised to 5 on a scale of 1 to 6 by the World Health Organization, and it is anticipated that this may change in coming days. The Department of Health's goals during this public health emergency are to reduce transmission and provide information to assist healthcare providers, public health officials, and the public in addressing the challenges posed by this newly identified influenza virus.
The way to interrupt transmission of H1N1 influenza, as well as traditional seasonal influenza, is to follow 3 simple principles. Number 1, cover your cough. Okay? That means currently, if you're doing it properly, that you cough into your sleeve like this. The reason for that is that the influenza is spread both by respiratory droplet, by cough, as well as on the hands. Therefore, the second message is to wash your hands. We all have, you can recognize now more and more members of the community, not just healthcare workers, by the hand sanitizers they carry around, using soap and water or the alcohol-based hand sanitizers to keep your hands clean on a regular basis. The third common sense advice is the advice that your first epidemiologist, your mother, gave you. If you're sick, stay home. Stay away from others. Don't pass the disease along. When you improve, you can rejoin society. If you get worse, contact your own healthcare provider, your physician, your nurse practitioner, your school nurse, and to find out how to proceed.